My first one is, how are we doing with getting an FDA-approved coronavirus vaccine?
We're all cautiously optimistic about the prospects for a vaccine. Right now, we have 4 different vaccines in what we call phase 3 trials. So they've sort of been through the preliminaries, and this is the final exam where we can examine the data to determine whether they're safe and effective. We are very optimistic because we know that most people mount a very good immune response and get over the coronavirus. And if a person normally does that, that means there's a good chance that a vaccine will work as well. Now, I want to make one thing really, really clear, and that is we're not cutting any corners on safety and effectiveness. The only corners that we're cutting is we're manufacturing the vaccine right now at risk. If that vaccine doesn't work, if it's not safe or effective, we sort of throw it away. If it is safe or effective, though, we'll have millions of doses available for the American public as soon as the FDA makes that determination.
So some people kind of believe September would be a trying month when it comes to the pandemic, possibly a second wave. They thought September would be. Here we're located in central Illinois, and actually our numbers, our positivity rates, things of that nature are actually kind of dropping. I mean, we're still seeing cases, we're still seeing deaths, as everybody is, but our cases and hospitalizations are kind of staying the same, and actually our positivity rates are dropping. How is the country doing overall, when it comes to these kind of statistics?
So overall, the country is doing quite well right now, but let me have a few caveats to that. So compared to our surge after Memorial Day, which was our big end of July surge that was all due to many people getting out on Memorial Day and mixing up, our cases are down about 40%. Number of people in the hospital is down about 54%. Number of people in the ICUs is down 65%. And the deaths are down about 32%. So these are all very, very good numbers. The problem is what's on average for the nation does not happen in every different locality. So we are seeing local outbreaks in many areas, many of which are associated with college campuses. College students do what college students do. And they tend not to mask during those kinds of events, and we're seeing spread among the college students. So right now, we are seeing, compared to a couple weeks ago, our number of cases have gone up somewhat, but it's mostly in the young, and hospitalizations and deaths continue to go down. But what I really want to make clear to your listeners is nothing is inevitable. It's not like we're going to have a spike or we're going to have another wave. It really depends what you do, on the actions you take, the personal responsibility you have. And Illinois has done a good job in general. Wear a mask when you can't physically distance. I know it's very hard, especially during football season with you got the Bears and everyone else, but avoid really crowded indoor spaces because that is a good place to transmit the virus. Wash your hands, do good hygiene. And if your public health professionals ask you to be tested, whether you're asymptomatic or not, please go be tested.
So a lot of, obviously, people and businesses have been struggling during the pandemic, and the big question on people's minds is, will there be a stimulus package? Are there stimulus checks? And I don't know if, Vice President Mike Pence or President Trump in one of the task force meetings or briefings has kind of talked about their perspective on if they want to see a stimulus package passed or anything like that. So I just kind of wanted to see if you had heard anything recently about where they're standing with that.
As you probably know, we have our task force meetings in the Situation Room because they're meant to be closed discussions, and I'm not on the legislative side, but I can say that I know Secretary Mnuchin and Chief of Staff Meadows have been actively working on another package to support many aspects, and we definitely want you to talk to your members of Congress because there's billions of dollars there for states, and particularly for things that I'm very interested in to support school reopening. And I think, I'm not the economist, I'm not the legislative person, but clearly the administration would like to provide relief to the American people, and particularly in those areas where we need to support businesses and get children back in school. So write to everyone you can, call everyone you can. The administration's position is that would be very helpful to the American people, but a large, wasteful, non-targeted strategy that just throws money at things not COVID related is not going to help us. So we need to put the money in the right place.
And this is probably the $1 million question, but do you guys have any idea when this pandemic will end?
It's actually a multi-trillion-dollar question, just to get the number of zeros. I'll give you a general answer, and I'll give you a very specific one. The pandemic will end when enough people either get natural immunity or they get immunity from a vaccine. That's why we don't have measles outbreaks, polio outbreaks, unless we drop below that certain level. So right now, about 90% of the American people are still likely susceptible to this virus. So we're nowhere close to it ending. Once we get a vaccine, and that's widely distributed. So it really is a multi-trillion-dollar and a multi-thousands of lives question about when the pandemic will end. The general answer is the pandemic will end when enough people have immunity to the virus that we achieve that herd immunity and it goes away. Now that herd immunity is a combination of either getting the infection yourself or potentially having some cross-reacting antibodies or T cells that you've had from similar infections, plus whatever we do with the vaccine. So we know that when the vaccine is widely distributed and people get immunized, it won't totally eliminate the virus, but it will bring it to non-pandemic levels. So that's the specific real answer. When will we have a vaccine? We have to wait for the safety and efficacy data to come through. But the estimates are if we do have a good vaccine, towards the middle of next year, we'll have hundreds of millions of doses available. The one point I do want to make, though, is you don't have to immunize everybody in the country to get a lot of effects. And I tried to make this clear in my testimony. Even if you have a few million doses, if you immunized all the workers in nursing homes, remember, nursing homes account for 40% of the mortality, and it's not because the nursing home residents are going out to block parties at night. It's because the people in the community come in. If you could immunize them, you protect them. If you could protect the people with chronic conditions, and we know who they are. Every insurance company, every Medicaid plan knows where the really sick patients are with renal disease or sickle cell. If you could even immunize those types of people, you can get an enormous benefit. And it's an estimate, but you could probably get 70, 80% of the benefit just by immunizing 10% of the people. So I am very hopeful that whatever amount of vaccines we have early this year, we could be very targeted and get huge benefit from that.
How soon after a vaccine is created should states and local municipalities begin to fully reopen?
I think, let me answer it a different way. We don't need a vaccine to fully reopen. If we drive the numbers down and use the cautious mitigation techniques that we have, like wearing a mask, like physical distancing, we won't be back to, quote, normal, but we can pretty much open most things aside from those businesses, and unfortunately, that really rely on indoor crowded spaces. So we can do most of that right now if we get the viral community spread down and we do those mitigation techniques. Once we get a widespread vaccine, we really have to see how it works, but most of the vaccines, not all of them, the trial that started this week is only a single dose vaccine, but most of the vaccines are 2 doses. So you have 1 dose and then 21 or 28 days later, you have a second dose. And then often you have to wait 2 or 3 weeks for immunity after that. So we have to vaccinate hundreds of millions of people. They have to get 2 doses. So it's not going to be immediate, but you'll start seeing effects very early. And don't think of it as a light switch that's on and off. Think of it as a dimmer switch. As we decrease the viral transmission in the community and we increase herd immunity, this will start to fade away and we gradually open up again. But I would like to see many more businesses open now, and in many parts of the country that can happen just with the tools we have right now.